study was over long-term functional outcomes of neurogenic thoracic outlet syndrome in surgically and conservatively treated patients. So for just a little overview of the abstract, you're talking about thoracic outlet syndrome, the neurogenic version, and of the neurogenic version, you have the disputed versus the true, and you have two different types of treatment, which is the conservative, or you can go through surgery. The purpose of this study was just to evaluate the long-term functional outcomes of patients undergoing independent medical examinations for disputed NTOS with sufficiently severe enough cause to miss work. And the functional outcomes were measured via questionnaires and interviews after they had follow-ups. And most patients were able to return to work and demonstrated an improvement of symptoms and long-term follow-ups. So just with a brief introduction, we learned that true neurogenic TOS, the diagnosis is rare, and it can only be diagnosed with electrodiagnostic tests. And disputed NTOS is the more common form that most people have that is electrodiagnostic, and reporting of functional outcomes is rare. And surgical therapy versus conservative management is the two type of deals that we'll be looking at today. Natural history of untreated disease is unknown, so that's also one of the causes of this whole study is to figure out the natural progression of the disease without any treatment. All right, so the methods from 1990 to 1998, they collect subjects from a hospital where they got 153 patients presenting with neurogenic thoracic outlet syndrome, and they went and verified all of these patients to make sure they actually had it, and they only included those with the disputed form of the disease. Once they collected all the patients, they divided them into a surgical versus non-surgical group. They followed up using mail questionnaires and phone interviews, and in these interviews, the patients were able to rank their symptoms and their improvement as they went through. And then further data was collected. 79 patients were reevaluated. Surgical patients ended up missing more work at the end of the day, and then changes in symptomatic status since the onset were similar in both groups, and 74% experienced improvement in the surgical group. So in the surgical group, there was more improvement, but overall, the people in the surgical group also took longer to come back to work. In conclusion, most patients were able to return to work. Future studies should evaluate randomized prospective trial comparing surgical versus non-surgical treatments on the long-term functional outcomes. And also, conservative therapy is the more favorable treatment course.
Diagnosis of TOS can be done through electrodiagnostic evaluations. Due to TOS, decreased amplitude of the median motor, ulnar sensory, and antebrachial cutaneous action potentials. Most pain is localized in the arm and shoulder. Neither treatment was able to fully eliminate patient's symptoms.
Case study weaknesses. The first one that we found was that the study only included 153 participants, which is a small control group. The follow-up process to obtain data concerning the study participants' symptoms post-op or non-surgical treatment was inefficient and inconvenient. Since the study was done in the early 90s, the mail was used as their primary way of obtaining data from patients. The questionnaire either had to be mailed in or a phone interview had to be conducted. The case study strengths. The detailed breakdown of the results for both groups was pretty extensive. The percentages comparing each group, surgical versus non-surgical, was extremely helpful, especially in doing further studies on this topic. Interviewing physician was not the same physician used in the initial evaluation, which that prevents the bias towards physician or participant in the study.
So this is over making the study better. And the article says outcome data have almost always been reported by the operating surgeon, hardly a disinterested observer. So this study could benefit from using third-party observers to keep the doctors from swaying the results in either direction. The doctor would know more about the treatment and what it looked like to become better, but a trained observer could be used in the study as well.
How does this study relate to biomechanics? Well, TOS, or thoracic outlet syndrome, is a disease caused by the pinching of the blood vessels and the nerves traveling between the first rib and the clavicle. This leads to pain down the shoulder and the arm and into the hand. This pain is usually increased when the patient lifts their arms or performs motions that involve a lot of overhead movement.